Next year, seniors and families are facing higher healthcare costs across the board. 23 million people on Medicare with a standalone Part D drug plan could see their premiums rise to $50 a month, up from $35, because the Trump administration is cutting the federal subsidy that has been keeping costs down. Part B premiums will jump 11.6%.
We are right now in negotiations.
The CBO has not agreed to that. The CBO doesn't say that. It's just the opposite. So you're saying the CBO and independent agencies that validate the costs are wrong?
In a heated Senate hearing, Senator Catherine Cortez Masto grilled Health Secretary Kennedy over the Trump administration's handling of prescription drug prices. Masto accused the administration of siding with Big Pharma after Republicans passed what she called the Big Beautiful Bill, legislation that shields some of the most expensive cancer drugs, including Keytruda, from Medicare price negotiations. Those drugs can cost patients up to $175,000 a year and drain billions from Medicare. Cortez Masto pointed out that while the administration claims to be lowering costs, Medicare premiums are actually rising.
Senator Cortez Masto.
Secretary Kennedy, thank you for being here. In May, you said, and I quote, "I stand with President Trump to say, no more middlemen, no more foreign freeloaders, no more skyrocketing drug prices. We're putting American patients first and taking on Big Pharma to make America healthy again." Yet your record tells a different story. In July, Republicans handed Big Pharma a massive win. Their Big Beautiful Bill that they just passed shields billion-dollar drugs like Keytruda, the world's top-selling cancer drug, from Medicare negotiation. Keytruda has been on the market since 2014. It pulled in nearly $18 billion last year in the United States alone. It costs patients up to $175,000 a year, draining Medicare of billions and forcing families into crushing debt or to forego life-saving care. And yet you support the Big Beautiful Bill. So despite the hype with executive orders and Washington Republicans only drug pricing law days relief for Medicare patients relying on high-cost cancer drugs, meanwhile, Democrats finally have allowed Medicare to negotiate drug prices. I will say that Keytruda, along with Opdivo and Darzalex, the three top-selling cancer drugs, were widely expected to be selected for Part B negotiation in 2026 for 2028 implementation. They are now, because of the actions of this administration, exempt from negotiation for at least several additional years, if not permanently. So my question to you, Mr. Secretary, is how do you justify claiming to take on Big Pharma while supporting a bill that shields drugs like Keytruda and other cancer drugs from Medicare negotiation, costing seniors and taxpayers billions, and risking the lives of cancer patients who cannot afford their necessary medication?
Yeah, Senator, I appreciate the question. The Medicare drug negotiations in the IRA were very well-intentioned, but they were poorly structured. And what we found is that the negotiations that have occurred actually have ended up raising the costs for Medicare. We are right now in negotiations. The CBO has
not agreed to that. The CBO doesn't say that. It's just the opposite. So you're saying the CBO and independent agencies that validate the costs are wrong?
Well, that is CMS data.
Okay, so let's just focus on the cancer drugs. Why aren't we negotiating those and bringing those down for families? Why does the bill exempt those?
It's part of the MFN negotiations. I'm not sure that provision in the bill of the One Beautiful Bill, but you're
not sure of the provision, the negotiation provision, and how exempted for
Keytruda.
Your agency is responsible for that negotiation, and you don't know about it?
I know that we're negotiating in the MFN negotiations.
Mr. Secretary. Let me ask you another question. How much are Medicare Part D enrollees expected to pay for prescription drug coverage next year?
I think that is in debate right now.
Let me tell you.
Are you talking about the rate?
They are going to pay $15 more than last year, up to $50 a month. Now, let me have a question for you on Part B. How much are Medicare Part B premiums expected to increase next year?
I don't know. I talked to
So
Dr. Oz
that
about
is
it
about,
yesterday. I think it's
they're supposed to increase about
16%.
11.6% or $21.50 more each month. And again, last time you were before me, you couldn't answer the questions of the very agency and the authority that you have to address these issues. You know, next year, seniors and families are facing higher healthcare costs across the board. 23 million people on Medicare with a standalone Part D drug plan could see their premiums rise to $50 a month, up from $35, because the Trump administration is cutting the federal subsidy that has been keeping costs down. Part B premiums will jump 11.6% to $206 a month in 2026, one of the largest single-year increases in decades. And so for an administration that claims it is lowering costs, my question to you is, what are you going to do to keep costs down for seniors?
I mean, I'm already doing I'm already keeping costs down.
What are you doing to keep costs down for seniors, knowing that these costs are going to be increasing?
I mean, the program integrity bill, that is the first action that I did when I got in. It's one of the earliest actions in history of a complex regulation by an HHS secretary. A congressional budget office has said that that's brought premiums down by 5%. That is the Congressional Budget Office, which does not like to acknowledge anything that we do.
And does that impact seniors?
Excuse me?
Does that impact seniors? And I know my time is running out. Does that impact seniors? What you just talked about, you're lowering costs. I'm asking you specifically.
We're lowering
helping
costs.
seniors. Does it impact seniors?
Does it impact?
Come on.
Let me just stop here.
I didn't
My time
hear
is
what
running
you
out,
said.
so I appreciate the chairman's indulgence here. My concern is you can't answer the questions. The very agency has oversight over these issues and controls the levers to lower costs for seniors. And you can't answer that simple question.
I didn't hear your question.
Okay, let's go.